Alright guys, if y'all haven't seen it yet, Vox is advocating for putting more drugs in our water. Kind of funny though, because back whenever I was still humoring the post of QAnon, Anti-School Isaac had talked about Apache being fentanyl whenever Q posted something about watch the water, whatever, and I did an extended version of that because of the fact that I was an emergency room nurse, and I talked about the effects of fentanyl and how it has already been found in the water. But this has gone to an extreme. Okay, fentanyl is one thing, and it's pretty easily reversible. Not advocating for anything being in our water. We already have such horrific, toxic fluoride. It's not fluoride, it's fluoric acid, whatever. It's a byproduct of waste from China and other places where it's actually supposed to be disposed at hazardous waste facilities, essentially like syringes, needles, hazardous, and they would have to pay like millions of dollars to dispose of this. But instead of paying millions of dollars to dispose of this, they just sell it to the Americans or give it to us, whatever, and we dump it in our water. Anyway, back to Vox. Well, get this. They want to put lithium in our water supply. Okay? If you don't know what lithium is, yes, it in some cases will prevent suicidal ideations, people that are suicidal. But in every single case with people taking lithium, they have to have normal scheduled blood draws. Why is that? Because lithium is extremely dangerous. Extremely dangerous. You have to have you have to titrate the amount that you're taking, meaning they have to go look in your blood and say, okay, your lithium level is this. It has to be between a certain number. Otherwise, you will overdose. And that's not easy to reverse, especially when you unknowingly are taking lithium or giving it to a small child in the case of water. So, Vox. So, this is a message to Vox. You put out whatever you want. You have freedom of speech. But to allow such dangerous rhetoric to act like lithium is the same as a vitamin, such as vitamin B or something. You can overdose on vitamin B, on vitamin C. It's possible. And not consult actual doctors on such an article is quite disturbing. And y'all want us shut down because of how we feel about things or whatnot? I'm not calling for y'all to be shut down. But I do feel that you have a duty whenever you have such a huge audience, that especially a young audience, that it is absolutely, completely irresponsible to even think of such a notion, to put something like lithium in water. It's bad enough. And then they had an article saying, Dr. Oz had that conspiracy theorist Aaron Brockovich on his show. Really? Because Aaron Brockovich won that case for that entire city, because they were hiding what that was going into the water that was causing cancer and causing miscarriages, which is going on now in other cases. 5G, for an example, same thing, causing miscarriages, and like an extremely high percentage. But it is absolutely irresponsible to act like you are some type of medical professional and put out something as dangerous as lithium and say that even to fathom the notion, and then to call actual medical doctors that have dedicated their lives, well, dentists and doctors have dedicated years, decades of their lives to trying to get this fluoride out of the water, because almost every other country does not put fluoride in the water. And guess what? They have a whole lot less anxiety, a whole lot less depression, suicide. Why is that? Because fluoride is, if you look on the periodic table, it's in the same table as, it's in the same column as chlorine and, let me think.
The water in Amesbury is supposed to have fluoride in it, but Rob Damaris has been concerned for years about what's in the supply he gets from China. The residue you see here is what won't dissolve when he puts the fluoride powder in the water.
What is that?
We don't know.
You have no idea what's in there?
I don't know what it is. It's not soluble. And it doesn't appear to be sodium fluoride, so we're not quite sure what it is.
Damaris says the residue clogs his machines and makes it difficult to get a consistent mix.
For almost a year, these fluoride pumps in Amesbury have been off, and the water department says they'll stay off until they can figure out what's in the fluoride.
The Department of Public Health says more than 650,000 customers in 44 communities are getting the product in question, and only Amesbury has temporarily stopped using it.
But despite those concerns, we want to be clear. Both state and federal health officials tell Team 5 Investigates Chinese fluoride is safe.
The New York company which supplies the fluoride in question says it is certified by the National Sanitation Foundation, which assures the quality of the product. And despite 1,000 complaints, the Centers for Disease Control also says it's safe, although testing continues to determine the precise composition of the residue.
They should test it to make sure that what they're putting in is safe for us to drink.
Paul Stewart lives in Newburyport and believes he has a right to know exactly what's in his water.
On the same day that I read the story about the fluoride coming from China, I also read stories about the melamine that was being contaminated in the milk products coming from China, that Abercrombie & Fitch actually pulled some of their jewelry off the shelves because it was contaminated with cadmium coming from China. And then we had another story about more lead in kids' toys coming from China.
Since 2007, most of the sodium fluoride has also been imported from China because it's the least expensive on the market.
I don't think that when it comes to something that I ingest every day, the lowest bidder is good enough.
I'd like to be able to add it in, worry-free.
For Team 5 Investigates, I'm Kelly Tuthill.
So fluoride, let me say, on the periodic table, it's fluorine. Fluorine, chlorine, bromine are all halogens. And halogens are toxic to our bodies in most cases. Another halogen is iodine. And so what happens whenever you have substances such as fluorine and chlorine in your body, they are competing. These are the things, they're competing for that iodine, okay? What do we need iodine for? Many things. Our thyroid is our main concern. And so whenever you have, that's why we have such an extreme number of cases of hypothyroidism, or hyperthyroidism, either way. It messes with your thyroid. It also messes with, because our kidneys can only excrete a certain amount of these halogens, especially fluorine. Okay, and so where does the rest of it go? Well, most studies show that it goes into our pineal gland, also considered our third eye, but it definitely has to do, it changes IQ points. Many studies, I'm going to show some studies that, I'll just get onto the studies, so I won't just ramble on. Fluoride is added to 70% of America's drinking water and has long been a controversial practice of involuntary mass medication. The CDC lists fluorination as one of the top 10 most important public health measures of the 20th century, but a group of nonprofit organizations is now fighting the EPA on the practice, citing the mountain of evidence that shows the little benefit to mass risk. Not only has but ingestion actually has many health concerns. Increasingly shows that it doesn't even improve our teeth while applying it directly, and being swallowed, it can, in fact, sometimes prevent tooth decay. Well, why do we fluorinate water? Well, that's just kind of weird. Frederick McKay began a 30-year study, which is known as the brown stain study of Colorado Springs. It showed a unique disfiguration of their teeth, molded pits, and they had unusually conditions. It was just, he used this one study and thought that by the high amount of fluoride was credited for both the lack of decay and the brown stain. But we now know that there is such a thing as dental fluoresis, which this only causes mild streaks in roughly 58% of adolescents. This is very mild discoloration. But the benefit of cavity decay reduction was thought to outweigh the risk, but that's in fact just false. Fluoride is essentially toxic to the human body, although in small doses, no acute effects have perceived, while our kidneys are able to filter out 50 to 60% of the fluoride we consume, but most of it is actually, the rest of it's stored in our body and it builds up over time. One main organ is the pineal gland, which is part of the brain that is responsible for regulating sleep, reproductive hormones, sometimes known as the third eye. This small gland has been linked to metaphysical abilities for many cultures throughout history. A philosopher, Rene Descartes, believed that the pineal gland is the principal seat to the soul. An estimated 40% of Americans have significantly amounts of fluoride buildup in their pineal gland by the age of 17. 30 independent studies have linked fluoride to a reduction in childhood IQ. A 2018 study published in Occupational and Environmental Medicine found that for every increase of 1 milligram per liter of fluoride in a pregnant woman's urine, their offspring averaged 2 to 4 points lower IQ scores at ages 1 through 3. This follows a 2017 study funded by the National Institute of Health, which showed the fluoride levels associated with IQ in 6 to 12-year-olds that had a lower IQ. Animal studies also have shown neurological effects, including impaired memory, reduced ability to learn, and even mild forms of brain damage. Potential health risk, like that you would think that this type of evidence would, there's no benefits to it. But they actually have no solid proof that there is any benefits. But a dental health study done in 1989 found that children who live in areas where the water supplies are fluorinated have tooth decay rates nearly identical to those who have non-fluorinated water. Fluorination was introduced in countries which do not add fluoride into the water, have seen the same rate of decline. So it has nothing to do with the actual fluoride. It just has to do with the health. So it's all about your dental health. The EPA has dismissed the citizens' petition to remove the substance and is now even trying to dismiss a lawsuit which would ban the use of fluoride under the Toxic Substances Control Act. They do have carbon filters that you can get to help remove this fluoride, and reverse osmosis tanks that you could put on your entire house, which is actually what I would love to have. And I feel that it would be much better to actually have, but there's no scientific proof of fluoride helping your teeth at all. Fluoride should be completely taken out of our water. It's absolutely insane.
The first widespread commercial use of fluoride was for the eradication of vermin. Since the 1800s, sodium fluoride has been a key ingredient in rat poison and insecticides. These products were commonly used in and around the home to kill lice, mice, rats, and insects. Fluoride proved to be not only a good way to kill rodents, but also an effective way to kill a man. As the use of fluoride became more popular, reports began flooding in of people dying from ingesting this toxic substance. Headlines screamed, "Roach poisoned in pancakes kills 11 men. Rancher takes dose of poison by mistake." Article after article, all having the same tragic endings, proving that sodium fluoride can and does indeed cause death. In fact, during the last part of the 19th century, the Industrial Revolution was taking hold of the modern world. An unfortunate byproduct of this technological revolution was that it created the most toxic pollutants known to man. And the most hazardous and destructive of them all was fluoride. In his award-winning book, The Fluoride Deception, investigative journalist Christopher Bryson examines fluoride's disturbing history. Bryson notes that in its early days, fluoride was a widely known and well-documented killer. Documentation from early lawsuits against fluoride manufacturers clearly shows that fluoride was a hazard, not only to humans, but to the environment as well, with damages reaching into the tens of millions of dollars. By 1930, the aluminum industry was the largest and most influential fluoride polluter. Industrial giants such as Alcoa knew they had to do something. Vegetation and livestock near Alcoa plants were being decimated as toxic fluoride fumes lingered, rendering nearby cattle lame and crippled, even causing death. One newspaper article from that time proclaimed, "During the past year, we had 51 head of cattle die. We had laboratory tests made, and these tests show excessive amounts of fluorine in the liver and kidneys. Also, some of our young cows had lost their teeth. Our saddle horses were so crippled from fluorine poisoning, they had to be shot." The serious nature of fluoride toxicity was beginning to be realized. As a result, fluoride's threat to corporate America was laid out in an exhaustive review conducted by the U.S. Department of Agriculture. Toxicologist Floyd Dietz warned of new medical information exposing fluoride's harmful effects. Danish scientist Kaj Roholm singled out the aluminum industry, specifically Alcoa, as the source of much of the fluoride poisoning. Fluoride was causing irreparable damage, and the word was getting out. Alcoa knew they had to act fast. Their high-powered attorneys sprung into action, quickly buying up farms and paying out settlements. Ironically enough, during that time, the U.S. Public Health Service was under the jurisdiction of the United States Treasury Secretary, Andrew W. Mellon. Mellon was the founder and major stockholder of Alcoa. He was also the founder of the Mellon Institute, an industry-funded research institute that was notorious for giving corporations such as Alcoa the scientific data they needed to defend themselves against lawsuits. The Mellon Institute published questionable and self-serving evidence that supported the effectiveness of fluoride in fighting tooth decay. In doing so, the Mellon Institute rats had put a smiling face on what had been a scientifically recognized environmental and workplace poison. It was an aluminum industry-funded scientist, Dr. Gerald Cox, who worked at the Mellon Institute, that first made the proposal to artificially fluoridate public water supplies. Mellon's economic interest in fluoridation was obvious. Fluoridation provided the chemical industry an opportunity to void liability of their poisonous fluoride waste by means of promoting it as a health benefit. The official human experiments began in Grand Rapids, Michigan on January 25, 1945. 107 barrels of sodium fluoride were delivered to Grand Rapids, where city technicians began tipping them into the city's water supply. They were the first to publicly fluoridate their water. It was to serve as the test city, and its tooth decay rates were to be compared with those of non-fluoridated Muskegon.
The study only lasted 5 years. There were no permanent teeth in the child born at the beginning of the study. It was an unblinded study. They did no measure of safety, and they claimed that there was a tremendous benefit to the permanent teeth. Well, there weren't any permanent teeth in the children who were born at the beginning of the study, and soon thereafter they fluoridated Muskegon, the control city. It's a phony baloney study used to demonstrate the benefits, where there are none.
Unfortunately, fluoride's ugly side.
Okay, I want to add a little bit of a personal story. The reason when I started looking into fluoride in our water, I'd moved from a place where we had well water, and we didn't have fluoride in the water. My anxiety attacks started, they were like almost gone. Okay, and then when we moved to where we have city water, I mean, within probably a month or two, my anxiety attacks came back, like at an extreme rate. Just different things were going on, and that's when I started looking into it. I was like, what is going on? And that's when I looked into fluoride. And then I wanted to know when we started putting fluoride in our water here. Oddly enough, it was essentially whenever I was like 3 or 4 years old. And then I came across an article of the mayor at the time, and he actually was against putting fluoride in our water. And his son lives in my neighborhood now. And I came across him. I was able to talk to him. My dad actually knew them and everything. Anyway, I talked to him, and he says his biggest regret, well, he had written this in a paper, and so I talked to him about it. His biggest regret while being mayor was allowing the city council to overrule him on that fluoride. And so we discussed it and everything. He said, you know, back before we put the fluoride in the water, we only had 2 kidney dialysis machines in our town. He said, now I couldn't even tell you. There's hundreds and hundreds. He said, and he voted no, but the city council overruled him, and he didn't fight it. And he said, you know, at the time, he was pretty much a new mayor, and he was just like, he didn't know enough about it. And that's what his thing was. But since then, he has learned a lot about it, and he completely is against it, and he has fought about it. And some neighboring towns have pulled the fluoride from their water, but yet ours hasn't. Many towns have, many big cities have, but for some reason, many places still do it. And it's very horrific, because let's not forget, who else used fluoride? They use fluoride in the concentration camps. I'll just leave it at that. Y'all have a great day. Like, share, subscribe. And all links will be in the description. Bye, guys. Y'all have a great day.